When it comes to evaluating kids for OCD, one is we can ask specific questions in a psychiatric evaluation, but we can also use measures too. So often psychiatrists can do things like what we call a PSI box, or a Children's Yale Brown Obsessive Compulsive Scale, which is considered the gold standard. So that can be helpful if you're suspicious. There's a self-report version that a child and their family can fill out, but also specifically asking around having intrusive and unwanted thoughts that are happening. Instead of using the word obsession, we use the word obsession in a colloquial way, oftentimes in our speech. So I often like to give the example for myself that people know about me, that I really like Peyton Manning. And so I'll say I'm obsessed with Peyton Manning. They know that I have all this, sports memorabilia related to him. But that's something that's really, like, I enjoy, watching sports. I enjoyed watching him play football. And people will talk about, oh, I'm obsessed with video games. But that brings people something that is enjoyable. So we really have to ask questions around things, thoughts that are occurring repeatedly, that are unwanted, and that they cause distress if they don't do something to alleviate them. So compulsion. So I really try to ask specific questions around if they're having these thoughts that are causing distress, and if they do any actions that help make them feel better. So a great example that we always give is for someone who's worried about germs, right? And they're always thinking and scanning in the environment and saying, oh, I'm worried that I could get sick if I touch this. Well, hand washing is a classic thing that would reduce their anxiety. So you can just think about that particular, scenario and put it in others. But the other thing is kids often too can't describe obsessions. They have something called just right OCD. So it's a feeling. So they might do something like count or touch things until this feeling of distress just goes down. So you also have to ask them if they have feelings or thoughts that are distressing, and that they do something to alleviate that.